Aging is a privilege, but as we age, our eyes have some things that happen to every single one of us. Let me tell you what they are and what you can expect as you get older. Number one, the most common thing I see in the aging eye is a cataract. Cataracts affect the crystalline lens. The crystalline lens should be crystal clear. This allows the most light in and allows you to have clear vision. Now, as we age, the lens turns yellow. This yellowing is caused from UV damage and oxidative stress that happens in our body just as we get older. This will cause the lens to become less flexible, which will affect your ability to see up close and in dark or dim lighting. Because less light gets in, you can't see out, and now you need to have cataract surgery. So cataracts, the most common thing, I always tell my patients that like gray hair and wrinkles, we all get cataracts. Macular degeneration. It's called age-related macular degeneration for a reason. Because as we age, we get macular degeneration. Now, in the back of the eye, where light focuses is called the macula. This gives you 20/20 vision. There's cells that produce waste. Well, there's also cells that are like the garbage men that pick up the waste. In macular degeneration, the garbage men go on strike and this waste accumulates. As it does, it will deteriorate your central vision. So you'll notice you don't see things quite as clearly as you once did. Keep the sun out of your eyes. It will help with cataracts and macular degeneration. Now, in addition, antioxidants such as lutein and zeaxanthin, vitamin C are all things you can supplement or get in your diet that can help keep that oxidative stress down and keep cataracts and mac degen at bay. Presbyopia. This is where you cannot see up close. I'm Dr. Lillie, I turned 40 and I now wear bifocals. Yes, it gets us all. I don't care how hard you try, the older you get, that small fine print is hard to see. I felt like overnight they started having ants just go on the menu because I couldn't see anything. As we get older, your ability to focus decreases. Part of that is your lens becomes less flexible. In addition, your eye focusing muscles become weaker. So no matter what you do, the older you get, you're going to need a bifocal or reading glasses to help you see small print. Dry eyes. Yes, the older you get, the drier your eyes will become. There's a lot of reasons that go into this, but one of the main reasons is your corneal nerves will become less and less sensitive as we age. This happens all over your body. As we age, we become less sensitive to things. Hot, cold, your eyes are no exception. When these corneal nerves get desensitized, you then produce less tears. You also blink less. This causes your cornea to have less protection, which causes more damage, which causes you to have more dryness. It's an additive thing that happens as you get older. In addition, hormones change the older you get. This change in hormones will affect, again, tear production, and this makes your eyes more and more dry. The last thing that you're going to notice as you get older are floaters. Yes, we've all seen them. Little squiggly lines that come out of nowhere. You think birds or flies are attacking you. Not good, but you get used to them. The inside of the eye is filled with a jello called the vitreous. As we age, that jello starts to liquefy and the powder will start floating around. When light hits the powder, it casts a shadow and you see a floater. You notice it when you look at white backgrounds, walk out into the sun, or stare at something for a long period of time. This will subside as you get older, it will settle, but they're always going to be there. It's a natural aging change. So as you get older, you get wiser, but you're also going to have these things happen to your eyes. Now these things are part of the privilege of aging. We get the gold award of cataracts and such. But the one thing you can do to make sure that they're not becoming a big problem that needs to be addressed is get yearly eye exams. I don't care if you need glasses or contacts, get in, see your doctor, and make sure your eyes are healthy. So if you learned something new, like, subscribe, and we'll see you in the next video.